So you have foot pain on the left side?
Yes.
And what's your first name?
Chelsea.
Chelsea? Now Chelsea, I can go a little lighter on you, but are you up for to see if we can get that?
Yes, I am, because it's been bothering me.
For a couple months?
Yes.
Okay, climb face up, Chelsea.
Okay. I'm nervous.
Is blue a good color for you? I think we only have blue.
Yeah.
This hides all the bruising and all the blood. That's, yeah. Okay, so Chelsea, apologize in advance for anything that's about to happen. I like to inject a little dry humor with people that I work with because a lot of times it helps them relax and it helps them to say, okay, this guy isn't like a mad scientist and all of that. But because her left foot is the one that's bothering her, I'm going to put nylons on both feet. Now, I want you to listen carefully, and you know what a spontaneous alignment is. Well, she's going to have some spontaneous alignments where the first phalange meets the long bones of the foot. And usually it's the last of 4 toes. The big toe never usually spontaneously aligns. And I can't say for sure that hers will, but is your pain right in here? Or where is your pain?
Some of it, but it's right. It goes from down here all the way down like that, but it's mostly like in this area.
Okay. So I want to ask a question here. Let me push your foot back,
Okay.
and I want you to curl your toes forward. And does that cause you pain in your heel or your foot?
Yes. It's
Yeah.
on the side.
Out here?
Yeah.
Right in
the
here?
lateral part.
Out here?
Yeah.
Okay. So let me do it this way. Curl again. Does that cause you pain?
A little bit.
A little bit. And is it right here?
Mm-hmm.
Okay. Is that where the pain mostly is here?
There, and it's like on the
Yeah.
bottom.
Okay. So there's more than one thing going on here, but I'm going to come in here and just see what kind of tenderness we have in the ball of the foot. Do you wear high heels on a daily basis?
On the weekends.
Okay. There was a little click in there.
Yeah.
There's another little baby one. Yeah. There's another one. And there's another one. So there's another little one.
Wow.
That 5th metatarsal just spontaneously aligned with the cuboid bone. So basically now I'm going to draw a line up through here, and I'm just going to,
Oh.
she likes that. I'm going to come out here.
And what kind of pressure are you using?
I'm using about intermediate grade. I'm using about half of what I use. I can see Chelsea's a little more fragile. I could see that just by her whole demeanor that she may not be as tough as Rob and Peggy.
It might be more intense.
Right. So what I'm doing here, she said she has pain out here, and so I'm working on the pelvic, hip, knee, leg. So any type of foot pain, numbness in the foot, leg pain, hip pain, this is a good area to work. The hip sciatic reflex is right under here. Right there will be a little sensitive. Yeah. So I'm just seeing if we can create a little analgesic effect. Now, just to give you a little perspective, let me see this hand. And this pinky finger right here, I'm just going to hold it right here, and that'll probably be a little bit tender, right? So let's just say if I held this finger right here, now, this only hurts when you walk on it?
And when I turn it, like when I roll it to like exercise it, kind of like to stretch it.
Okay, can you roll that foot for a minute? And does that hurt right here in this area?
Not when you just worked on it.
Well, it doesn't hurt at all?
It's just cracking.
But you said when you roll your foot, it hurts.
But you just worked on it.
I know, but okay, I'm just checking in with you. So it doesn't hurt right now.
It doesn't hurt right now.
Okay, well, I was going to hold her pinky finger. If it did hurt, I was just going to show you how you could hold the pinky finger to try to turn that off, but unfortunately, she said it doesn't hurt now. So I don't think I did quite enough yet, and I didn't open up my cell phone, but we're just going to come in here and do a little bit more because... Now, by the way, this area right here is her large intestine. This is the descending colon reflex. So, and I'm not using very much pressure at all here.
It's just very tender there.
Yes, let's do a comparison. Let's look at this side. Let's see. I like to do a comparison for people. Now let's see what this side is. Not as tender, but it's
not
tender.
as bad, but it's tender.
I just want to create a bilateral scenario here. So I want to release those on this side, just so she'll have two pair of happy feet. So we're going to come back in here.
I wish I could do that. Can I do that with my foot? You can do that with your own foot?
Yes, you can. Only if you can tuck your ankle behind your knee, your ear, though. I'm just kidding.
When you worked for low back, you did all directions. Are you going to do all directions on?
Yes.
Okay.
But usually in the ball of the foot, I only go up, or I'll
Okay.
only go across, because to come down, it's just ergonomically, it doesn't work very good.
Okay.
So I usually only go up.
You're using the same thumb technique, just in different areas.
Exactly.
Okay.
Exactly.
Do you think though by working on yourself, you'd probably be a little bit more gentle with yourself and
Yes,
not as
absolutely.
effective?
I would be.
You could not create the discomfort because your brain won't allow you to. You're not that stupid. You know? I mean, nor is anyone. You're not going to create the kind of discomfort, nor can you. I haven't found that anyone can work on their own foot and create as much discomfort as someone else working on it, you know. But, how you doing, Chelsea? Yeah?
She's not
It's a
screaming
little less
anymore.
tender, isn't it?
It's a little.
A little. I didn't say a lot. Let's come over here and see what her lower. Let's look at her kidney reflex. Just
Oh, gosh.
ooh.
Ah.
OMG.
And when you just put your fist into the ball there, were you flexing it back?
I
forward,
do drink
hold-
water.
hold
I do.
pressure against
You
it?
do?
Not enough, apparently.
I'm just using this to bring
Well, I know, but
reflexes.
you put your fist right there like that. Was that just bracing it so you can work it?
Exactly. I'm pushing it back so I can look at her lower lymphatic right here
Mhm.
and just see what kind of tenderness was in there. But I want to do enough here to. So for Chelsea, if her discomfort continues, I want to see something here. Let me see this hand again. I want to see what other fingers are tender. So I'm going to look at the posterior and anterior aspect. See, that's not even tender. When I go into the medial and lateral aspect, so we have to go on the right aspect. With her, it's medial and lateral. Let's look at posterior and anterior
That's.
a little bit. Let's look at this one. That
Ah!
one's really tender. And that one, not so bad. And that one, okay.
Ow!
Do you have anything going along your spine? Do you have any back pain anywhere from your neck to
Yeah,
your...
my shoulder.
Okay, so along the center?
It's on this side.
This
right
side, okay, so this corresponds to the left side, but she has something going on in the first zone right there, because that thumb is really tender. And so this finger was, let's look at this medial, okay, let's look at this. So that middle finger is really sensitive. So the third zone, the fifth zone, and most all zones on this side of the body don't paint a great picture about Chelsea, indicating that she has a lot of congestion along those zone lines, which indicate she doesn't have adequate blood supply through those zone lines. And these are pretty consistent with most people. Most people, including Joy, who didn't think she had any tenderness in her feet. And if we palpated your fingers, Joy, we might find the same kind of tenderness.
Now, when you were doing the fingers, were you just doing the first digit, or were you going
Right
all
on
the
the
way up?
joint space.
So here
Distal,
and here?
that's right, right on the distal joint spaces. That's where all the proprioceptors are. And those are going to communicate to some degree with the brain.
I got a question.
Yes.
So you don't really do it's called what, Vitaflex in terms of figure doing?
No. I just keep moving in a forward direction.
Okay.
I'm always moving. I never stay stationary. I'm going up, down, or across, up, down, or across. Always moving.
Do you do that at all in hand, or you just do the hold the pressure?
Okay, with the fingers, I use a static pressure, non-moving, and with the feet, I use a compressive forward-moving, thumb walking or finger walking pressure.
So this is more just kind of to figure out like where.
It's actually to treat as well. You can treat. So Chelsea, let's just see. Let me stretch this here. Let me stretch.
Are you flexing?
I'm just trying to stretch out her gastroc and soleus a little bit. Now, does that foot hurt anywhere right now?
No.
Okay. Would you stand up for me for a minute? And what does your foot feel like right now?
You can,
Can you roll your foot or do anything to create sound?
no.
So it feels good now? Okay, good. Thanks for being a good sport today.
It hurt, but it's worth it.
Yeah, so what if your foot doesn't hurt for a while or for a long time now?
I would love you forever.